Hello, I'm Dr. James Bogash, expert in health and longevity and creator of Bogash Life in Balance. And today we're going to talk about the study out of European Journal of Epidemiology that threw everybody in a tizzy on all sides of the discussion and what it really means and what I think it really means, which should not come as a big surprise. But this was a study looking across 68 countries and 2,947 counties in the US, like a huge study. And the bottom line is that they didn't find that vaccination protected against cases at all. As a matter of fact, in some countries, some areas, higher levels of vaccination led to more cases. Certainly a whole nother set of conversation with that, but what this really means, there are some people saying that vaccinations are not effective. We need to be a little bit clearer on that, because it's pretty clear that vaccinations do decrease severity and things like severe cases and hospitalizations, even though that efficacy is waning, hence the need for boosters. And there's a lot of concern with that. That's just, I'll leave it there. Won't discuss that in this particular video. But that has to be taken into account. So we're not talking about severity or hospitalizations, we're talking about cases. And it is very clear that vaccination does not stop spread of SARS-CoV-2. Why this is important is because of this whole forcing vaccine mandates and this chunk of the population that seems to think, they initially thought, I'm using they, but they initially thought that masks were going to stop the spread. They were the answers. And then they thought vaccination was going to stop the spread and that was the answer. And people who didn't wear masks or didn't support masks, or people who didn't vaccinate or support vaccination, were just like, people hated these people. Like, that's how far it's gone, because they think, well, this will stop the spread. I think it should be clear by now, and this study is just the nail in the coffin, that vaccination doesn't change spread. And you can certainly argue that less people are likely to get people who are vaccinated are less likely to become sick and less likely to spread. It doesn't matter when we look at big picture. It's not making a difference. And so the whole idea of mandating things, or even better, just testing people who are unvaccinated, is ridiculous. If you're really concerned about stopping the spread, then we need to test everybody. Hence the, Carnival learned that the hard way when the vaccinated passenger got on sick and ended up dying and contaminating multiple members of the crew. So that's just another example that the vaccine is not doing what people think it is doing. It is clearly affecting, at least for that short time window, we don't quite know how long that time window is, it's affecting the hospitalization and death, but that's your own personal decision, right? It shouldn't be something you force on somebody, because it's not going to make a difference in spread. So what does this really mean in the big picture? And because masks aren't the answer, they never were. Vaccination, this particular vaccine, is not the answer. It never was. And so what do we do? And my answer is, of course, the freaking thing we're not talking about is lifestyle. Well, you can't make lifestyle changes overnight. We've been going on this for 2 years, almost 2 years, and we're still avoiding the pink elephant in the room about how much the choices we make, getting your butt out and moving around, making sure your vitamin D levels or sunlight exposure is top, keeping fasting blood sugar under control. My gosh, why are these not part of the discussion? Those are truly, when all else fails. And I've said this from the beginning, that everybody will be, like, I feel that everybody at some point will be exposed to SARS-CoV-2. It's just a matter of how your body, how your immune system responds to it. You can use vaccines as a temporary, key note there, temporary crutch, but it always will boil down to how healthy you are. And if you haven't fixed that in 2 years, I don't know what else to say. Nothing is going to help you, and ultimately, you're going to be exposed, and how bad it is for you has everything to do with the choices that you make. And to think that it doesn't is lying to yourself and completely denying everything that we've seen with SARS-CoV-2. This is not some powerful, miraculous virus that does strange things we've never seen before. It's acting just like every other virus. It just has a nastier outcome for people with pre-existing health conditions. So fix the pre-existing health conditions. Don't look for a miracle drug or a miracle vaccine or a miracle face covering that's going to stop this. I have said that since day one. My story has not changed, and that story is still not being shared by both the mainstream media and public health officials, which is just flat out deplorable. As always, I will post a link to this particular study in the description. Make sure you like this video, share it with somebody who you think needs the information, and subscribe to the channel.